Major depressive disorder, MDD, is a serious mental health issue that affects all walks of life. It is the most common psychiatric mood disorder, leading second in disability worldwide. In 2013 alone, MDD affected over 32 million people, with only 12 million sufferers actively seeking treatment. Major depressive disorder accounts for 90% of suicides and is an ever-growing, debilitating condition which can be prevented by psychological support and drug treatment. MDD is linked to the hippocampus, which plays a prominent role in explicit memory formation and providing homeostatic responses to stressful stimuli, emotion processing, and other circuits such as the cognitive control network. When we take a glance at the pharmacological side, there are many drugs available that can help with MDD. These drugs operate based on the monoaminergic pathway involving the neurotransmitters serotonin, norepinephrine, and dopamine. This pathway is associated with reward, motivation, and decision-making. MDD affects the chemical balance of these neurotransmitters by altering their reuptake mechanisms in the brain. This can result in a lack of motivation, lowered libido, guilt, and similar depressive emotions. Drugs available to treat MDD include first-generation antidepressants, such as tricyclic antidepressants, and monoamine oxidase inhibitors. Second-generation antidepressants include selective serotonin reuptake inhibitors, SSRIs, and selective norepinephrine reuptake inhibitors, SNRIs. Recently, a new drug called vortioxetine has demonstrated effective results in the treatment of MDD. This drug is a multimodal antidepressant which specifically targets serotonin receptors and its transporters. Vortioxetine is orally administered once daily at 5 to 20 mg doses, with an oral bioavailability of 75%. For a 1-month supply, vortioxetine costs $62. In comparison to its competitors, duloxetine costs approximately $17 per month, and venlafaxine costs approximately $15. Other drugs such as fluoxetine can be available as little as $10 per month. In comparison to these drugs, vortioxetine is more costly to the individual, but may outperform in its treatment effects. Vortioxetine has a high affinity for the SERT reuptake pump, and the blockade of this pump consequently increases the amount of serotonin in the synaptic cleft. Additionally, vortioxetine blocks the 5-HT3, 5-HT1D, and 5-HT7 receptors. It also stimulates the 5-HT1A receptor and partially stimulates the 5-HT1B receptor, which allows serotonin to remain within the synaptic cleft for longer without being degraded too quickly. When investigated under multiple clinical case studies, vortioxetine's performance was favored as being an effective treatment for MDD, with only some studies having reported negative side effects. Vortioxetine's performance was tested in a 2014 double-blind randomized placebo study for 8 weeks, recruiting participants from ages 18 to 75. The results of the study were based on the Montgomery-Åsberg Depression Rating Scale, MADRS. The results are summarized in this table. Vortioxetine had a lower and therefore greater improvement MADRS score than duloxetine. Additionally, these statistically significant results show remission and response rates were higher in vortioxetine than the placebo. When vortioxetine is compared to other drugs such as SSRIs and SNRIs, mixed results have been reported. An overview of 15 studies that included a total of 7,746 participants found vortioxetine to be more effective than the placebo in the response rate, remission, and alleviation of depressive symptoms. A 2014 clinical study investigated vortioxetine and agomelatine 12-week study of 491 patients switching from common SSRIs and SNRI drugs. The study revealed vortioxetine to have had significant improvements and lower withdrawal rates than when compared to SSRIs and SNRIs. The results obtained from the study concluded that overall, vortioxetine showed superior results over agomelatine when switching from SSRI or SNRI drugs. Moreover, vortioxetine is a cheaper alternative to generic first-line treatments. In a 2018 Norwegian case study, vortioxetine had an overall lower mean cost than the SNRI duloxetine. Researchers studied 344 successfully treated patients, STPs, on vortioxetine and duloxetine for 8 weeks. 168 patients were given vortioxetine and 176 were given duloxetine. Researchers were able to conclude that vortioxetine outweighs duloxetine in relieving most symptoms caused by MDD, thus highlighting the potentially cost-effective treatment of vortioxetine for both the pharmaceutical industry and sufferers of MDD. Thanks for watching.